is not very sort of comforting for a social scientist trying to work in the field of AMR. It's very, very minuscule what has been produced of social scientists with regards to the AMR threat. And it's sort of a bigger problem because AMR is so obviously a problem that needs social science inputs, both on the global level and the meso level and the local level, right? So that was sort of a big surprise for me, that you simply didn't find a lot of social science research. And the research that had been published was mainly published by medical professionals. And so what I'm arguing is that we need to have more social sciences that influence not only medical anthropology, although that's very important, but also that illuminate some of the other more gray areas, specifically at the global level and national level. So in my review, the challenge is not so much popularizing scientific knowledge, but to mobilize and to build networks and so on. So what is it we need to set the agenda? It's not just awareness, it's trying to build coalitions outside the medical community, because right now the medical community is driving the agenda forward and also sort of defining the agenda, framing AMR as a health issue. But I think in order to really get our footing in the sort of global political agenda, we need to sort of begin to build bridges to other, you can say the public, to other NGOs, to lobbyists that are much more flexible and much more knowledgeable about how to actually put issues on the political agenda, because that's not the forte of health expert, I would argue.
One thing that I would say that from our analysis, it promotes this question of, are we wanting to protect people or to protect medicines? And we started out with the rational medicines, rational drug use programs, wanting to rationalize drug use in line with making it cost effective and making it safe. With antimicrobial resistance added on top, a warning I would put out is that, let's be careful not to shift our entire kind of effort towards just saving the medicines. The reason we're saving medicines is still for the same end, which is to protect people and to provide the best quality care. There's an increasing amount of social research that is pointing to the fact that the reason that we're using antibiotics isn't just because of somebody trying to make a decision and having all of these influences around them, but actually there's much wider, more infrastructural reasons that we end up using antibiotics. Antibiotics end up propping up our systems. And while we've still got such poor hygiene and really, inadequate health infrastructure in many places, and we've not got the capacity to do really good patient care, antibiotics at the moment are propping that up. We need to be really aware of that before we push messages to just stop using them. We also follow the science and the policy object of AMR. So we can see that antimicrobial resistance has successfully, I would say, become stabilized as a political object, which you can see in part because it was made into an economic issue. And also because it was made into a global security issue, in addition to the health issue that we knew it was before. Doing social analysis of the ways that policy is formed is incredibly important. It helps us to realise how we are gaining traction with certain issues like AMR, but by labelling it an economic and a security issue, it focuses our minds on particular things that will address the security angle, for example, of antimicrobial resistance, which may cause us to focus more on spread and may cause us more to do certain things like extract information from some places to put on a global platform so that we can check whether AMR is moving around the world. That's quite different to addressing it as a health issue. So we do need to be really careful about the ways that we are framing the problem in terms of the kinds of things that we end up thinking of as being the solution. How do we communicate with policymakers? In terms of communicating with policymakers, these people have an incredibly difficult job. When I'm discussing with people who are trying to make policy, first of all, they are sitting and they are always balancing up this and this. They say, you know, well, I'm being asked to promote AMR as a really important thing, but you need to give me this information, and you need to give me the economic case, or you need to give me this information in order for me to be able to take that forward. So I would say it's less that I communicate with them, and it's more that I take a brief from them in terms of looking at, well, what do we need to do then? What information do we need to provide for you so that you can do your job?
So I think that the main challenge when trying to if you want to make it more global or more on the global agenda, is that it's still very much driven by the health community. Health experts are very good at framing or understanding an issue and understanding what are the problems with the issue and communicating that. But that's the first step. So the second step is to actually make it to the political agenda. And here I think we have a problem, and it shouldn't be the health experts or indeed social science experts that should push the agenda, but a much more broader coalition of actors. I think we need a broader coalition. It's not about, you know, the science, it's not about pushing science, it's not about awareness, it's about networking, building to external actors that are much better at pushing issues than academics are. It shouldn't be our job, or especially not health experts. They have enough. It should be sort of generate a network of other actors, lobbyists and so on.
Maybe just a thought from the fact that I'm with UNICEF, and UNICEF is also very globally concerned about AMR. 40% of the deaths globally among children under 5 are caused by diseases whose treatment is and will continue to be affected by the growing threat of AMR. So prioritizing children within the AMR agenda is also really, really required to protect every child's right to health, as well as tackling this global challenge. So drug resistance is perhaps one of the greatest threats to child survival and global health from UNICEF's perspective, and it really threatens the continued progress on child health, as drugs which are needed to tackle very common childhood illnesses are becoming less and less effective. So I think it's really important that as we move forward, current policies and initiatives to tackle AMR, which rarely address the specific needs and vulnerabilities of children, we need to make sure children are at the center of the AMR agenda to protect every child's right to health.